Today we're going to demonstrate the fixture level impression technique for the Straumann implant system, bone level. There are two ways to do this. We'll talk about both of them briefly. Open tray and closed tray techniques. When you see your patient, there will be a healing cap in position. It's a simple matter to remove the healing cap, generally with finger pressure. It might be necessary to use the torque wrench, but that's typically not the case. Prior to me releasing the patient to you for the impression, I will have checked the ISQ value of the implant to make sure it's stable and ready for restoration. So you should have no worries about destabilization of the implant. So the closed tray technique is slightly simpler than the open tray technique. And this is really practitioner dependent as to which technique you choose. The closed tray technique has one component. Once you identify the implant that you're going to take the impression, you simply place the fixture level impression coping, closed tray, into the implant itself and finger tighten it into position. With the closed tray, there's no need to modify your impression tray prior to the procedure. Once the impression coping is finger tightened into position, there's a little snap cap that you put on top of it, and the arrows should face from buccal to lingual. At this point, it's a simple matter to seat your impression. Once the impression has set, you pull the impression and the coping actually stays in the patient's mouth. There's no need to remove it until the impression has been removed. Then you simply remove the snap cap, unscrew the impression coping, and quickly place the healing cap back on so you don't lose tissue volume. And then the impression coping and the snap cap are placed back into the impression itself and sent to the lab. So it will only go in one way, and then the lab can attach the analog when they get the impression. So that's the closed tray technique. The open tray technique is slightly more complicated. However, once you do it once or twice, it's very simple. It will be necessary to modify your impression tray in the open tray technique by making a hole above the impression post so that it will actually protrude through the impression tray. I find it helpful to make a hole in the impression tray and then place some wax over the top of it. Beeswax is fine so that your impression material will not exude out. You simply remove the healing cap and you finger tighten the open tray component initially, and then using your screwdriver you'll want to hand tighten it into position. And then you will seat your impression tray over the top, and it will stick out through the wax. So you'll actually now see the open tray component coming through the impression tray. Once the impression material has set to completion, you need to remove the component, again unscrewing it, and so that when the impression is pulled, the open tray component pulls in the impression, so it's in the impression material itself. You then would need to replace the healing cap fairly rapidly so you don't lose tissue volume, and then the lab will be able to attach the analog to your open tray component once they get it in their facility. Again, both techniques are accurate. It's practitioner dependent. My bias is for multiple units, open tray is preferable. For single units, certainly closed tray is sufficient.